Have you heard about delirium? There is something called delirium, and most people confuse delirium with dementia. Hmm? Yeah, some people can even confuse it with depression. You see these 3D: depression, delirium, and dementia. Sometimes they can be confusing, but this is how to make the difference, or to make yourself as a caregiver or as a healthcare provider understand this better. So, delirium occurs within hours, days, weeks. It barely most times lasts up to 1 month. It barely. Then dementia is a progressive ailment. It goes from weeks to months to years. It's progressive. It just keeps getting worse. But delirium can happen to someone today, tomorrow they are fine. 2 weeks time, it will hit back. The next morning, the person is fine. Then depression is yes, depression is treatable. Dementia is not. Like you can treat it, you can just manage it. Then depression is treatable, and depression have similar symptoms with delirium. Delirium happens in two ways. Delirium can make someone that is quiet to become proactive, to have responsive behavior. It can also make someone that's usually socialize, talk with people, to become self-conscious, like be inward. The person doesn't want to eat, the person doesn't want to talk, the person doesn't want to go for the activity the person usually go for. So watch out for this. Watch out for this. As PSW, we do not have the power to diagnose this, that someone is having delirium, depression, or dementia. But why it is good for us to have the knowledge is so that we can do appropriate documentation of the things that we have seen. Because if you know the reason why something it might probably be happening, you'll be able to understand the situation better, and you know what to do at that particular time. Most time, delirium should be handled as emergency. It's something you see immediately and you report it immediately. You don't have to wait till the end of your shift to document it. You have to verbally report it immediately, either to your supervisor, to nurse in charge. Then you also document it at the end of your shift. Okay, because sometimes it can be side effects of some certain medication. There can be an underlying something that is causing it. It can be a pain or something. So it's something that should be attended to immediately. Depression, if you notice, well, you might not really know the difference, but just know that delirium occurs is something that can occur. You can come for a shift today and this particular resident is acting up, is all over the place, is so responsive. The next day, the person is back to normal, the way they used to be. It can be delirium. Then dementia is progressive. Sometimes dementia can come with sundowning, so it's quite challenging. But understanding that these things exist, an elderly person can also be depressed. Depression can cause someone to be angry, to be defensive. You come into the room, the person say, get out. Depression can also make someone to go inward. Delirium can also make the similar thing, but the only thing with delirium is that it comes and goes. It just hits and it disappears the same way it hits. It can stay couple weeks, it can stay couple days, it can stay hours. But depression lasts longer, while dementia is for sure progressive. So get to know this. If you're not cleared with everything I've said now, you can drop a comment on this video, then I'll be happy to share more information. And please, if you notice anything different from a way a resident is acting, is not their usual way of behavior, please take it as an emergency. Go verbally report it immediately, and also remember to document. Please, we are their eyes and their ears and their hands, so we are there to care for them, right? To advocate for them and to make sure they are safe.